Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. Thank you for finding this channel. Please click subscribe and hit notifications. Drop a comment in the comment section below once you've watched the contents of this video and share it with somebody because trust me, the information that you are going to come across is vital. Crucial even. And joining me for a chat is Dr. Simon Kigondu, the Secretary General of the Kenya Medics Association. Hey, Daktari, how are you doing?
I'm good, Sheila. I'm good, Sheila. It's been a while, but it's nice to catch up.
It's good to see you.
Same here.
Sawa sawa, naona uko hospitali.
Yes.
Have you gotten your shot yet? I hear the vaccine finally crossed the borders.
Number 166. I had my shot. Actually, when you were calling me today, I was at Kenyatta National Hospital getting the vaccine. I'm number 166.
Are you serious? You're the 166th Kenyan.
Yeah. So health workers are in the first tranche of people vaccinated because they are likely to come across clients with COVID-19. So you those highly high at risk, those who are likely, and because we go to theater, do operations, and you never know the disease is within the community. So frontline healthcare workers are encouraged to actually get the vaccine.
Okay, seeing as we've jumped straight into the issues of today's conversation, March 3rd has come and gone. Of course, Kenyans are asking each other, so can we be out past 10 p.m.? What does this mean? The vaccines have come. And I know it's not in your place to speak to the curfew and its contents, so we'll put that on a shelf for just a few minutes. Let's just dig in to this exercise that's been conducted today. So tell us about the vaccines. We'd like to know a little bit more because there's also a bit of controversy as well that's brewing with the same. So let's first get to grips with this vaccine. Where did it come from? And you've already mentioned who it's going to first. And then we can talk about a scandal that surrounds the same.
So as the Kenya Medical Association, we've actually been running the COVID series. We have 2 webinars on Tuesday at 7 p.m. and on Thursday at 2 to 3 p.m. The Thursday ones are actually COVID clinical webinars. And we've had about 3 COVID webinars on the vaccine. And we brought in the experts to explain what this vaccine is and how it works. Now there are hundreds of COVID vaccines under development. But the ones that have been approved for what is called emergency use, they have been given what is called emergency use authorization, are several, they're about 8. And the ones that are being used in Kenya, the one that we are getting is Covishield. Covishield is the one that has been used, that was imported to Kenya. And these are the Ministry of Health has a COVID program, and people who are charged with actually making sure that the COVID vaccine has been planned for and has come. And this culminated on Tuesday, I think, with the arrival of Covishield, of which I'm grateful to be one of the first people to get.
Where is it from? Where did it come from?
So the one that we are getting is an AstraZeneca vaccine. Okay. And there are other types of vaccines that are being given. For instance, in America, they are using the mRNA vaccine called Moderna. So there are various vaccines on being used, and they have what is called emergency use authorization. Traditionally, the process of release of vaccines used to take a long time because you have to go through all the phases of production of phase 1 trials, second, third. But this particular vaccine got emergency authorization and has actually been given to millions of people around the world. And that's what gives us courage, so to speak, that the vaccine is useful. And as scientists, we have followed the trend of where the vaccine has been given and what the effects on disease acquisition and progression has been, and it has been shown scientifically that where the vaccine has been administered to a large group of people, then the disease burden actually decreases. A good example is the country of Israel, where with their population, they were able to give a large chunk of people, and studies have actually shown the disease impact is actually lessened. So because of both the logistics of bringing in and of course the cost, then countries like ours have to budget for that and bring in and then prioritize. As you know, a scarce result, just like the human resources for health, has to be sort of planned for.
Yeah.
And the program that they eventually would want to give in Kenya, 25 million Kenyans to achieve some form of impact. And therefore, you have to start somewhere. So there are three phases. The first phase is on healthcare workers, frontline, and vulnerable, and then to the general population.
Okay. Now, you've mentioned the order. So part one is about essential services and service providers like yourself, people who are quite literally in the front line. Then we've got who's going to be next, because and exactly how many doses have come in for this first phase? Do you have the numbers for that?
So for phase one, we plan, the ministry has planned for 4 million doses. And then there is phase two, and then finally phase three. And by the end of phase three, there should be 25 million doses. So that is the plan by the Ministry of Health. So the first phase, as they said, is for frontline healthcare workers. And then they will probably include like the security services, the police, and the teachers, because again, teachers come in contact with a lot of students, a majority of there are many students. So those are the planned initial phases. Then the vulnerable people like over 60 and things like that, and people with conditions such as diabetes, hypertension, and things like that. And then to the wider general population.
Okay. There's been talk about the validity of these vaccines, and I think this week a lot of Kenyans were checking out a letter that was actually sent by a certain group of religious doctors who were saying, we don't really need this vaccine, and it's caused a bit of consternation, and people are wondering. Here we are being told to stay safe and wait for the vaccine. It's finally here. And now some members of the medical fraternity are saying, no, don't touch it. I know there are also people online who are saying, hey, the process of approving this vaccine was way too fast. Why are we in such a hurry to go and queue up for this vaccine? What have you got to say about those claims?
The way we look at it in the scientific world, so to speak, is that we operate on what is called evidence-based medicine. So the evidence thus far has shown that the vaccine is safe and efficacious, the scientific evidence thus far. And there's a scientific process, a method that is used to get all these things out there. So, and the goodness with science is that what is applicable in the US is applicable in Kenya in terms of scientific findings. So science is what is called a repeatable item. Many people will have their views about vaccination, and their views will come from many areas. So we may have people having listened to internet. We have people who have listened to other people who may not necessarily be authorities in the issues. So our advice is that we need to listen to science, not even to the scientist. I may be a scientist, but I may be saying this wrong thing. But there are formal ways in which this information is disseminated. Right. The latest controversy, as you put it, is actually not a controversy. It's an opinion of one or two people, but put an umbrella. So it's sort of taken out of context. So let us not have one or two people being thought of as a representation of everyone. And I came out there and actually said that this view is not the view of majority of us who are also part of that scientific community.
Right.
So the issue you're bringing up is one of what is called vaccine hesitancy. And there are many factors that lead to vaccine hesitancy. And what has been identified as one of the biggest factors to vaccine hesitancy is the attitude of the healthcare worker. So exactly as you put it, if a healthcare worker comes out there and says something negative about a vaccine, then more people are likely to believe them and not actually go for the vaccine, even if it is useful for them or to the community.
Right.
So at Kenya Medical Association, what we are working at is reducing the number of healthcare workers who have vaccine hesitancy. And how do you do this? You roll out training programs, teaching. We have been running webinars teaching the healthcare workers about the vaccine. And the other thing is also to participate in the vaccination itself and give people scientific evidence. The health workers will actually listen to the science. This reduces the gap of the number of people who are hesitant. As a result of that, the vaccine uptake increases, and that is the method that we are using to reduce what we are calling vaccine hesitancy. A lot of fears come from the fear of side effects. And it is not in our place to say that side effects will not occur. And indeed, they may occur. But there is something called pharmacovigilance, whereby these are recorded, and then you see whether these are as a result of the vaccine. And this leads to both improvement and identification of the issues that may lead to possible side effects. But you're looking at the bigger good. Does this vaccination program help life to come back to normal? Is it good? Is it bad? So that is the way we are doing it. So we are working to reduce vaccine hesitancy by education.
Okay. You've got your work cut out for you, that's for sure. Schools were opened, midterm came and went, and I think most schools are getting ready for end of term exams, and then it's going to be a holiday. And with holidays, there's a lot of travel, and then everybody comes back. Do we have enough capacity to roll out as quickly as possible? Because some of the things we've been reading about concerning the vaccine, especially in distribution across in developed countries, for instance, is they say this thing is not like some of these medications you can put in the fridge for 2 years and it's still fine. It's got a very short shelf life, and you've got to be able to transport it and administer it within a certain window of time. Now, we find ourselves in the developing world in the thick of our summer season. Do we have enough capacity to ensure that none of the vaccines go to waste?
Actually, the vaccine is a very scarce commodity. I am sure within the end of 3-4 weeks, it will be over, at least the batches that have come. Yeah. So it's unlikely to be wasted, especially this particular one, because it is one in short supply, and it's for those who have been in frontline COVID management, it's in high demand, so to speak. And secondly, is that the vaccine is not administered to people under 18 years of age. So I saw where you are going in terms of school. We are not going into schools and all. So because the vaccine is not tested in children. And thirdly, as we put it, science has shown that the effect on children may get what is called infected, but it's not as bad, so to speak, to children as it is to the older adults and people in frontline health work and the so-called vulnerable. And that's why when you see that inverted mode of addressing the vaccine, is that it starts with the high-risk people, healthcare workers, security, and teachers. Then it moves to the elderly and those with diabetes, and then finally to the general, usually the adult population. So eventually, I think, yes, it may be administered to children, but it is still under emergency use authorization, then it's being given to adults. Therefore, I don't think there's a problem with, there will be no wastage. It'll be over before you know it.
Okay. Going back to the headlines, we've had a few people in power, I'll say, saying, you know, we are also looking to get vaccinated, but we'd also like to see the head of state get vaccinated. When it comes to politicians, where do they fall in the line of essential services? Were they present today as you were getting your shots?
No, as actually the Ministry of Health has done a fantastic job, and they are actually keeping up to the protocols. It will be good to have the president there vaccinated, but the head of state of the country, is actually respecting the order that has been put in place by the Ministry of Health, and hence the most important first person to get the vaccination was the Director of Health, Dr. Amoth, who is a consultant gynecologist, but at the front line of the technical aspect of health. And that sends a good message. And then also it was done at the Kenyatta National Hospital, which is the teaching referral hospital. That's also a good message. So in terms of sending the correct message, it is important that you have the healthcare workers in the lead, just like you having them in the lead in the management of COVID. So we must give it up to our head of state and the politicians for actually respecting the healthcare workers and the process in which that has been suggested. So for me, the Director General represents the head of state in terms of this vaccination campaign.
We're just about to wind up. I'd like to speak about side effects because you made mention of that, but we didn't really unpack what you feel. And it's been a couple of hours since you got your jab. Any side effects, anything we should know about? And for others who are watching, what can they expect when they get that vaccination?
So before you get the vaccination, there are some lovely ladies there who actually take you through what to expect as side effects. So they tell you that yes, the jab is generally safe, but you never know. You could expect some side effects. And of course, the first one may be pain at injection site. So far, my injection site, I haven't had any pain, so I'm waiting. Yeah. And then there are other side effects. Maybe some people may feel a bit giddy, some form of dizziness. Some maybe nausea may come up at a time, and headache. Headache has actually been mentioned as one of the side effects. My sister actually works in the United Arab Emirates. Actually told me that the side effect that she got was headache, but they were getting a different types, which is the Chinese Sinovac one and the UAE. Therefore, those would be expected because the body would react to the vaccine and the side effects. And they have said that should I get severe side effects, I could go back to the Kenyatta National Hospital. And so it's a monitoring. And it is important actually to identify and treat side effects because side effects, even as expected, you do not want them to be the ones that stall the vaccination process. Because someone was not able to deal with the side effects.
And again, making reference to what you had mentioned earlier in our conversation, I'm sure there's documentation that's also happening for everybody's experience as medics, as lay people. You're all part of this. You're actually part of our first study of what to expect with this vaccine, and it's going to help in research and in also dealing with whatever lies ahead for all of us as a human race. But in closing, I'd like you to speak to what happens next. Where are we? Are we heading, because we've worked with you right from day one. And whenever anything significant happens, it's always important to touch base with you, because then it almost feels like you prepare us for the next level of this journey. So what do you see happening next? Does this curfew get lifted? Are we better off now? Can we open up a few bars? I mean, the weekends are coming and they don't stop coming. What do you see going forward?
Yes. So as we mentioned earlier, we saw that what the recommendations were for opening up the immunity. And I will not stop emphasizing that we should continue wearing our masks. Remember that COVID-19 is an airborne disease, and therefore wearing of masks actually reduces transmission. And this has been evident. I don't know whether you have noticed that actually as people continued wearing masks, the transmission has reduced. And you see sometimes when people stop wearing masks, like when you have an increase in political rallies, then now the curve starts going up, and we start getting warned that, oh, if you start doing that, then that. So we urge people to continue wearing masks, washing hands with soap and water, and the social distancing thing. From this data that we have collected, this data will be transmitted to the Ministry of Health, who will then with the other sort of considerations of the economy, send it to the political class. And the political class will make a declaration as to whether we need to open up or not. But I am quite optimistic that actually the Kenyan population has reached a stage whereby they are mature enough to actually do the right thing, and that my suggestion is that opening up the economy, the curfew, I suppose the movement restrictions has been the biggest bone of contention, so to speak. I suppose that if they continue following the COVID protocol rules, these will open up. And I highly suspect it might be.
It might be the case. And if not, we've all figured out how to live with a 10 p.m. curfew. Let's just keep doing the right thing until it's safe for all of us to be out and about.
We are actually learning to live. Human beings are very versatile. They actually adapt to all conditions, although there are some conditions that sometimes you may not really adapt to. For instance, the taxi driver I used yesterday was saying, oh, we really need to open up, so that not everyone is driving the taxi between, is it 4 and 9? And therefore, you also open up the space for the economy at night. So it would be a useful consideration, considering that we have actually done a good thing. And as you had, you remember what I was telling you about our case control study of a neighboring country? I think you are actually now seeing the logic behind what is being done by the government and the Ministry of Health. So,
and as much as we were all up in arms, they made the right call.
Yes.
All right. Fantastic. Thank you so much, Dr. Simon. Patient, should I? Oh, I can't really call you patient. I'll call you 166. I can't imagine what my number will look like, but when the time comes, the time will come and you'll be the first person to know. Thank you so much for this update. I wish you well. I'll be checking up on you. Are you going to go for a second dose, or is the one that we're getting just a one shot and that's it?
April 30th. At 8 weeks, you get your shot, and that's the recommendation.
Okay, all right. So I wish you well. I'll be walking with you. I'll be checking in on you to make sure you're doing good. But thank you so much for this update. Nimeshukuru sana.
Yeah. We want to thank you also. You're doing a good job, because the media is one of the people who are responsible to actually educating Kenyans on these things matters. And when you interview the experts, then people get to learn through your show.
Thank you. Doc, it was really important for me from the get-go that I work with someone who understood what was happening. There's no way you can argue with the science of a disease. You need somebody who knows more, who helps you see better, because whenever there's something people don't understand, we come up with all kinds of stories to help us cope and deal with what's happening. But it's so important to have a scientific understanding so that you're doing the right things. And I'm so thankful. It's been 1 year, Doc. 1 year since our lives all changed completely. But you've been there and you're still here. And now you've got the vaccine swimming in your veins. Way. Thank you so much. And I'll keep walking with you to find out how you're keeping.
All right. Thank you very much. It's been
Thank
nice.
you, Daktari. I hope you've enjoyed this episode. Please share it. It concerns very powerful conversations on the vaccine, on vaccine hesitancy, and so much more. Drop us a comment in the comment section below if there's something that you've learned or you would like to inquire, so that the next time I'm speaking with Dr. Simon, I can share your question as well. Until next week, Monday, please do your best to stay safe. All the best to everybody who's received vaccine already. Be patient, wait your turn, and in the meantime, do all those things that you know will keep you safe. Wash your hands, don't touch your face, maintain social distancing, and just eat good. And maintain mental stress issues. Keep calm. We're going to get through this. A good day is on the way. Until next week, live out loud in all you do. Daktari, kwaheri sana. Can you wave with your hand? Is your muscle okay?